Knock, knock, knock. Hi, Allison. Are you awake?
Yes.
My name's Megan. I'm going to be your nurse today. I'm going to be doing a abdominal assessment. So, are you okay with that?
Yes.
I will have to expose your abdomen area, but I'll try to keep you as private as I can possibly.
Okay.
So, I'm going to move this blanket down. I have brought a couple towels. Do you want those?
Sure.
Okay. Is that all right for you?
Mm-hmm.
And then here as well. I am going to raise this bed so I don't stoop. So from my general survey, I don't see any distension of the abdomen. I see even pigmentation. I don't see any red petechiae. I don't see any visible pulsations at this time. So, alright. So I'm just going to start off with a few questions, Allison. Are you taking any medications right now?
No.
No? Do you drink alcohol quite frequently?
No.
What's your typical food look like? Like spicy food?
I think I eat a lot of carbs.
Carbs?
Yeah.
Are they pretty bland or spicy, sweet?
Just bland.
Okay. Do you drink any caffeine?
No.
Not at all?
No.
Okay. Do you exercise daily?
Not daily, but maybe like 3 to 4 times a week.
Okay, that's good. What do you do to exercise?
Weightlifting.
Alright. And you know to use proper body mechanics when you are doing that weightlifting?
Mm-hmm.
Yes, okay. Do you stress a lot in your life? Do you have a lot of stress?
Yeah. School is pretty stressful sometimes, but I've been able to manage.
How do you cope with your stress?
Sleeping.
Good, good. How many hours do you sleep a night?
It depends on how much homework I have, honestly. Typically 6 on average, I would say.
Alright, so I am going to recommend that you sleep about 8 hours a night just for full rest.
Mm-hmm.
How many meals a day do you eat?
2.
2. Do you have a pretty good appetite
No.
with those meals? No?
No.
Can you tell me more about that?
I just eat when I think it's time to eat.
Okay. Do you usually eat your full plate of food that you make yourself?
Yeah.
Okay. Do you ever have any difficulty swallowing or chewing that food?
No.
Okay. Do you have any intolerances to food?
No, like allergies?
Yeah, like sometimes people will drink milk and that'll upset their stomach. Any of those things?
No.
Spicy foods
Mm-mm.
hurt your stomach? And what's your bowel habits look like? And you can opt out to say this if you would like.
I know I have one at least once a day.
Okay.
I don't be counting, honestly, but they're not irregular or anything like that.
Okay, that's good. Have you had any procedures done on your abdominal area?
No.
Have you had any surgeries in general?
I had my tonsils removed.
Okay. Did everything go okay with that?
I hope so.
Did you have any complications?
No, I don't remember it.
Alright. Any cancer?
No.
Have you ever been diagnosed with a abdominal problem such as irritable bowel syndrome or GERD?
Mm-hmm.
No? Alright. Do you have any pain in your abdomen?
No.
No. How about, do you have a family history of any GI issues?
No.
Well, I'm going to start my inspection. So for the contour of the stomach, I see that's flat. If it was protuberant, it'd be sticking out more. If it was scaphoid, it'd be curving more in. I see symmetrical ribs on this side. So I will later palpate that to confirm. The umbilicus is inverted and it appears to be in the midline. The skin appears to be smooth, even pigmentation, as I stated earlier. It appears to be dry. I don't see any irritation on the skin. As I said, no red petechiae, no red lesions. So, no abnormalities noted at this time. I don't see any presence of pulsations now that I have a further inspection. So, the patient's breathing appears to be within the 12 to 20, so I don't see any super using their abdominal muscles to help them breathe. So I am going to start my auscultation. I'm going to clean it first. With this, you tell me if you have any pain with any of the things I do. I'll try to warm this up really quick. Alright, so I am going to start in the right lower quadrant and then we'll work my way around. So right now I'm listening for bowel sounds. So I did hear active bowel sounds. In the clinical setting, you would need to listen to each quadrant for 1 whole minute in the presence of bowel sounds. You should hear 5 to 30 per minute. If they were hypoactive or you didn't hear any bowel sounds, you would then need to listen to each quadrant for a total of 5 minutes and then assess from there. And so now I'm going to listen to your aorta. I'm not going to press very hard. I'm going to be listening to your renal, iliac, and the aorta pulsations. I'm going to listen with my diaphragm first, and then I'll switch over and listen with my bell.
Done. You want the rest of the place?
Okay, thank you. Alright, now I'm going to be listening to the renal arteries. Now that I've identified all the pulsations, I can move on to my bell. With the bell, I don't want to press very hard because then I'll just make that a diaphragm. With that, I didn't hear any irregular heart rhythms. I heard the S1, which is also known as the love dub. So, no abnormalities noted. And I heard that with all your aortic, iliac, and renal arteries. So now I'm going to start percussing. Let me know if you feel any tenderness with this or pain or if something doesn't feel right to you. So with this, I'm going to be tapping on my middle finger and listening for tympani. Tympani would be that's on a hollow organ or known as an air-filled organ, so like the stomach. And then you have your solid organs, which are going to be like your liver, your pancreas, and those are going to be dull sounds. So I'm just going to be tapping around. That was your stomach, and I did hear that tympani. Okay. So now I'm going to be doing your percussing your liver in specific. I am going to be measuring this in centimeters. Normal parameters for this liver margin test is between 6 to 12 centimeters. So what I'm going to do is I'm going to start percussing here, and once I hear dullness, I'll mark that area with my pen, and then I'll keep going, and once I hear the dullness leaves, then I will mark my pen there, measure that. So let's start down here. Just gonna make a small little mark there. So I have 8.5 centimeters, so that is within normal parameters of the liver. Hepatomegaly would be an enlarged liver, so this is something that we could identify with this test, and then we need further testing to guarantee that, but that was not abnormal. So are you able to sit up for me?
How much do you want me to sit?
Just 90 degrees, bend nothing else. So with this, I'm going to place my palm underneath your costovertebral angle, and I'm going to put my 4 fingers on each kidney, and I'm going to strike my hand. You tell me if there's any kidney tenderness. So I am going to move this up just a little tad bit. Yep. So close to you. Did you feel any tenderness?
No. No.
Put that back. Have you lay back. Alright, then I'm gonna just do some light palpation. Tell me if this hurts at all, or you kind of feel some uneasiness with that.
Mm-hmm.
So I'm just gonna do light rolling circular motion, feeling for anything that would concern me for further clarification of what it was. Alright, I didn't feel any hard knots, no, I was easily palpable, so I didn't feel any distension in the abdomen. And then lastly, there is a deep palpation, which is going to be for the liver, the kidneys, and the spleen, but those are things that we as nurses shouldn't do because of the risk associated with it. And I forgot the aorta. So with the aorta, what you would want to do, it's about 2.5 to 4 centimeters wide, and it runs right about right here where we're doing the pulsations, listening for it, auscultation. So with that, you want to use your opposing thumb and finger of the four hands, and you're just going to be feeling around for it. But with this, if there's like an abdominal aneurysm, aortic aneurysm, you wouldn't want to do that because you could cause it to rupture. So, and then with the kidney, you would test the right kidney with the duckbill method. So you'd make a duckbill with your hands and you'd just be feeling on the bottom for the kidney. But again, only the doctor should really be doing that. For the spleen, you have you're going to reach your left hand under the spleen, this rib cage right here, and you're going to be palpating. If you felt the spleen, that would be a stopping point because that would indicate some enlargement of the spleen, and we don't want to cause that to rupture. And then with the liver, we can use a hook method and feel under that, and we wouldn't want to do that either because of the bleeding that could be associated with the hepatic portal vein. So, do you have any questions for me, Allison?
No, I don't.
All right. Thank you for your time today.
Yeah, of course.